Is alcohol good for heart? Is drinking alcohol on a daily basis going to keep you healthy? Let's find out in this video. I'm Dr. Prasoon. Welcome back to Dofudi. Is alcohol good for heart? The short answer is yes. Modern science and the doctor community, based on several studies, think that alcohol is actually good for heart. But is alcohol good for your heart? Now that's the question. So there are two sides of it. Please make sure that you watch this video till the end. Many observational studies have shown that people who drink daily in moderation, they live healthier, they live longer, and the chances of getting heart attacks for such persons is very low. So now the obvious question in your mind will be, which type of alcohol is good for you? Scientific evidence has shown that the alcohol content itself, that's the key element that makes your heart healthier. Alcohol increases the HDL cholesterol. Now you know that HDL cholesterol is a good cholesterol. Higher the amount of HDL cholesterol you have in your blood, the more healthier you are. Alcohol also prevents blood clotting, which in turn prevents the formation of blood vessel blocks, leading to diseases like heart attacks and strokes. So it actually doesn't matter which type of alcohol it is. A large study conducted in Italy showed that 31% of persons who drank 1 pint of beer every day had fewer chances of heart diseases. Now the most important point to keep in your mind is the word moderation. Now what is meant by moderate use of alcohol? In a healthy adult, up to 1 drink in case of women of all ages, and the same 1 drink in men older than the age of 65 is considered as moderate use. Now 1 drink means 12 ounces of beer, that is 355 ml of beer, or 5 ounces of wine, which is equivalent to 148 ml, or 1.5 ounces of distilled spirit, examples of which include rum, whiskey, gin, vodka, which is equivalent to 44 ml. Many studies have also shown that as you increase the quantity of alcohol that you drink every day, your chances of heart diseases also increases. Now, according to NCBI, the protective effect of alcohol, although it is present in individual levels, it is largely absent when it comes to the adult population level. In clinical or medical practice, it is very important to know the amount of alcohol that a patient is drinking every day. Now, this is important because it directly correlates with the several complications that the same patient can develop simply because of the alcohol intake. As I told you earlier, as the quantity of alcohol increases, the chances of heart diseases also increases. Studies have also shown that approximately 20 to 30% of patients who are admitted to hospitals are alcohol abusers. Now, what do I mean by abusers? Those persons who do not have a control on the amount of alcohol they drink. Ethanol, the major component of alcohol that you drink, can actually damage your heart. Now, the damage caused due to ethanol is striking when the amount of alcohol intake exceeds 90 grams. It doesn't even stop there. Heavy alcohol consumption can lead to sudden cardiac death and cardiac arrhythmias, that is irregular heartbeats, and many such heart conditions. If you are a patient who has already suffered coronary heart disease, studies have shown that alcohol intake leads to increased mortality rates. It has also been shown that persons who are under the influence of chronic alcoholism, that is, who have been taking alcohol for a very long period of time, in such persons, the chances of heart-related complications is very high, particularly post-operatively, that is, after any surgeries. Now, examples of such complications are mostly due to ventricular dysfunction, particularly with the occurrence of severe infections or even septic shock. Now, such complications are 3 to 4 times more common in chronic alcoholic patients when compared to occasional alcoholics or non-alcoholics. So what is the message that you should take away from this video? Now there are two possibilities. First one is that you are an alcoholic. Now if you drink alcohol in moderation, that is less than a pint every day, and if you find it very difficult to stop the habit of alcoholism, you may continue it. But you should also keep in mind that if you increase the amount of alcohol that you're taking every day, if the moderation is not under your control, then you are at a higher risk of developing heart diseases. Now, the second possibility is that you are not taking alcohol. In that case, please do not consider taking alcohol simply because that you can make your heart healthy. There are many other healthier ways to make your heart and your overall health better. And drinking alcohol in moderation is not the first step that you should be doing. Instead, adopt a healthy diet. Include more whole grains, fibers, fruits and vegetables into your diet. Practice physical workouts and exercises that you can do, and do it at least 5 days a week, and that too 30 minutes every day. Now these are the harder things to do, and drinking a pint of alcohol will be the shortcut. Never do that. If you haven't started alcoholism, you are on the safer side. Just believe me. The study that was conducted actually makes the conclusion a bit more complicated one. It doesn't mean that a pint a day keeps the doctor away message is a true one. The study did show that non-drinkers are at higher risk of developing heart diseases when compared to persons who drink alcohol on a daily basis. The study that was conducted was actually a cohort study, and you need to remember that studies like these cannot be used to conclude that alcohol intake or the lack of it can prevent you from heart diseases. Many health, diet, and lifestyle factors should also be considered, but these factors were not considered in that study. When you look into the detail of this study, it actually showed that persons who drank alcohol in moderation, they were at a 30% reduced risk to develop the first episode of a heart condition or a heart disease. Now this study was actually a long-term 4-year long study, and it looked into the medical records of approximately 2 million adults who had not developed a heart disease at the start of the study. 14 units of alcohol every week. Now that is the latest moderation guideline that has been recommended, and it keeps on changing. We cannot depend on that. Now when the study was conducted, it was 14 units per week for women and 21 units per week for men. It should also be kept in mind that people who drank alcohol above the moderation level, now they were at higher risk of developing all types of heart diseases. It should also be noted that persons who used to drink alcohol, that is former alcoholics, or persons who drank alcohol occasionally, they were also at higher risk of developing heart diseases when compared with non-alcoholics or persons who drank alcohol in moderation. Are you strictly following a healthy diet? Are you eating fruits and vegetables at the required levels every day? If your answer to these questions is yes, and if you are also an alcoholic, then your alcoholism is under your control and you can continue it. But otherwise, if you are not doing the other things that are required to keep your heart diseases and other complications away, please do not consider drinking alcohol or starting it. So I hope you like this video. Please share this video with your friends and family, and particularly with those friends who tell you that a pint is going to keep the doctor away. So until I see you in the next video, it's me, Dr. Prasoon. Take care, stay healthy, and thank you so much for watching.